The healthcare system traditionally, frankly, needs redesigning. Public views that hospitals are the be-all and end-all and the place that everybody must go. We have to try and help individuals and the public at large understand that hospitals need to be the last resort, not the first resort. They're dangerous places. You go there if you've got a critical illness. You go there if you've got something that is immediate. If you've got any sense, you want to be out of there as soon as you possibly can. Not only puts lives back on track, but actually it's cheaper to do it in an individual's home than it is in hospital. Now the money is, to everybody out there, a secondary issue. And it's not about cuts to services. It's not about anything to do with that. It's about the fact that over the next 10 years, the health service will actually run out of money. People will not be able to earn enough money and pay enough tax to support it in the way that it's happening at the moment. And need to find a mechanism somehow to get to that harsh truth in a cross-party and educated way so that we don't start the little campaigns to keep something open and to not change this and to not change that. The early results of the consultation, which I have to say I'm delighted with the response so far, it's really, really good. The public are really getting behind this. The early responses say that more than half the people who are actually involved in using health and care services haven't got a clue how to complain, haven't got a clue how to give feedback. And the underlying issue is the fact that because they haven't got a clue, because they don't necessarily believe that it's going to be acted upon or taken notice of, so they don't bother.
On about, the agenda for the National Health Service is exactly the same as ours. Promoting health and well-being, shifting resources from hospital-based services to more accessible community services that people actually want. And people rely on support from both ourselves and the National Health Service, and it makes no sense for them to live in parallel universes, shifting costs from one to another. They should work together, and it just makes common sense. And I picked up early on in what you were saying about people with knee-jerk reactions to, oh, don't close that. And actually, there's something better around the corner. And my discussion with Nigel Ratcliffe was a couple of weeks ago when he was saying that we get everybody moved out into the community, and it's right. And then the saving is that we don't need as many hospital beds, and there'll be uproar. Hospitals are places of the last resort when you need acute care. Let's keep you out of that situation. And we all know, I wouldn't call it, well, we all know the issues around hospitals when we get there, and you're better off at home if possible and not getting you there.
Paragraph 27, where it says the agenda of the NHS is exactly the same, promoting health and well-being for the whole community, enhancing self-care and shifting resources from expensive, because that's the word you missed out, expensive hospital-based services to more accessible community services. Again, I will read it because I cannot put it in better words than what's written down here. It says, these health reforms will deliver better services for the people of Staffordshire through being a commissioning authority rather than a provider of services, and looking at alternative models of delivery, services will deliver better outcomes and value for money.
Of Staffordshire, how we do it shouldn't absolutely matter. It should be what they get out the end of the sausage machine. Great services, confidence, really efficient, really cost-effective, 5-star services for 2.5-star costs.
Going and concentrate on outcomes. And I think we're just going to have to communicate with people and explain what's going on the way, on the journey, make sure that they can make logical decisions and not knee-jerk reactions and people jumping on bandwagons that happen to pass by for popular moves.